Testing. Hello. You'll work the PowerPoint? You'll just do the PowerPoint? I'll do the PowerPoint. Okay. Okay. Perfect.
Okay, we're going to go ahead and get started, and we'll start with our presentation. I'll do a little countdown, 5, 4, 3, 2, 1. Good afternoon. Today is Tuesday, May the 20th. This is Public Health and Safety Committee. We don't have a quorum yet, so we will be starting with our presentation. But prior to that, just to give everyone a heads up, we did not have anyone sign up for public comment, so we will not have a public comment. So first, we're going to hear from representatives from Metro General Hospital. And so I'm going to turn it over to them so that way they can introduce themselves.
Good afternoon, everyone. My name is Lisa Sampson. I am the ED manager, and this is Kelly Fox. She is our ED case manager. We also have Ashley Midkiff, the ED director, with us, Kate Haygood from the foundation with us in the back, and Veronica Elders, our CEO interim, in the back with us today. So we're here today just to talk to you guys a little bit about what we do at the hospital for our unhoused patients. Next one. So I'm sure most of you know that 580,000 plus people experience homelessness nightly. As Nashville's safety net hospital, we care for a large number of those patients. And their needs go beyond just basic medical needs. They need help with food, they need help with clothing, they need shelter. There's multiple issues that go along with that. Some of those needs are weather-appropriate clothing, shoes, toiletries, food, blankets, or sleeping bags, especially for those that are actually sleeping outside and do not use any of our shelters. We have patients that come in with shorts in the middle of winter. We have patients that wear holes all through their shoes. We have one patient that does this on a regular. They just walk. So there's just holes in their shoes all the time. And we have supplied their shoes for the past probably 2 years. The staff watches it and notifies us, and we do everything we can to keep them in shoes that don't have holes in them. Also last summer, we had a patient arrive to our ED in paper scrub bottoms, no shirt, no shoes, and he had been recently discharged from another hospital. He was sunburnt, he had blisters on his feet, and he came to us seeking help. When he left our hospital, he was fully clothed, he had shoes on, and he had been treated for his medical issues. Some of our initiatives that we've done to address these needs of the unhoused patients are we have 2 closets, one downstairs and one on the inpatient that we stock with supplies. These supplies are not stocked by the hospital. They're through the foundation, they're through partnerships, donations, the staff reaching out and getting donations. It's all done through that we stock these closets to be able to better care for people. The All-Weather Wellness Fund is done by the foundation. They help us with that, and that asks for more donations from different places. We also have some nonprofit partnerships that I'll tell you a little bit about. Our foundation, the food pharmacy, and then we also communicate with community services to see if there's any resources they can use to help us. So we really exhaust all possibilities just to be able to give some basic needs back to our patients. One of those partnerships is Bridge Builders. They're a nonprofit, and actually what they started to do was to put school supplies in all of Metro's closets. So they do a closet, fill it with school supplies. But we reached out to them, and they started donating backpacks that are full of toiletries and a water bottle. Sometimes they have food that's non-perishable in there. And they have donated over 600 backpacks this past year that we give out to anybody in need. Also, recently, we ran out of shoes for men, and we reached out to them. And within 2 days, they had 30 pairs of brand new shoes at our hospital. So they're a very valued partner, and we're happy to be with them. The foundation, Nashville General's Foundation, does a lot to help us. They're the ones that monitor the All Wellness Fund. which is year-round. We change up what we need. What do we need for summer? We need shorts, we need shoes, we need toiletries. In the winter, we're going to push towards coats and pants and gloves and all those things to keep people safe. They also help write grants for supporting our food pharmacy. They assist in advocating for our needs and of our unhoused. So they're a very valued member of our team as well, and they do several other things, but that's what they do to help assist us. So what we need, not praise, not credit, just tools to help our patients survive and ideally to heal. So how can you help? You can donate to the All Wellness Fund, supplies, or there is a donation barcode on it. You can promote our initiatives in the community, get the word out about us and that we're collecting, and so that other people will help. And you can also share resources with other nonprofits that do a lot of these initiatives with the unhoused that might want to team up with us to see if we can better care for them. Because I know there's several people that are working to help the unhoused. So maybe we can team up and do a little bit better. Some of our immediate needs right now is shorts and pants, deodorant, underwear for male and female, ponchos, especially with our rain that we have lately, sunblock, and then sanitary items. This is our contact information for all of us here tonight. And then we will open the floor up to any questions or comments.
Thank you so much for being here. And I guess to give everybody some context, so back in December, Metro General employee, I'm on, of course, like all of you, you're probably on all your neighborhood pages, HOA pages, that kind of thing. And so there was a Metro General employee who had posted where she was seeking donations to help fill the closets that they were describing kind of at the hospital. And the response from her neighborhood was really tremendous. I volunteered, got some more from some other neighborhoods. And so anyway, that kind of led me down a path of getting interested in kind of how they, what supplies they're needing. And they were very gracious to invite me to come to the hospital where I got to take a tour of the closet area and learn a little bit more about some of the issues that folks are experiencing when they physically come into the hospital and then when they're discharged. And so I was very, of course, impressed with everything they had done to this point. But I think what they really, how they really need our support is with building their network of people and organizations who may want to support kind of the work that they're doing. And so that's one of the reasons why I wanted to bring them to committee today, is to have them have an opportunity to share what they're doing, kind of what the biggest needs are, and for us as individual members to think through, the ways that we can support them with our networks and our resources. And so I know, Lisa, you had mentioned, of course, we talked about this before we got started, about size needs, and of course, like men's shoe sizes, how challenging some of those sizes can be to find for the patients that you all are working with. And can you speak a little bit more, I guess, about some of the size needs and also related to the condition of the clothing that you're looking for?
Absolutely. So shoes for men, we're looking at sizes 10 to 15. More 10 to 13 are our main sizes, but we do have patients with the 15. And the patient I spoke of that we keep them in shoes, their size is a 15. So those can be very hard to find. And that's not the typical sizes that people grab. Also, the clothing, since we are a hospital and we have to worry about infectious concerns, the clothing has to be brand new. So men's sizes are more in needs, men's pants, men's shorts, versus women, we see more men than we do women. So more of those supplies are needed, and medium and up, medium to 2X for our patient population as far as sizes with shirts and pants. We were lucky enough to receive a donation of T-shirts that somebody had all brand new made. So we have a lot of T-shirts, but that doesn't go very far if you don't have anything on the bottom.
Yeah, thank you very much for that. And then tell us a little bit more kind of related to the needs that you have. You're currently collecting for summer, and then at what point will you transition into kind of the winter drive and collection needs that you'll have?
So probably about August, September, we will start transitioning so we can go ahead and get the list out, and it will switch up dramatically to warm weather. We get a lot of hats, a lot of gloves, and that's amazing. But the big stuff like clothes to layer with, pants, coats will go through a closet in one winter. It'll be gone, even with all of our partnerships. And it's so cold outside. The sleeping bags, we've had several donated, but we hold on to those. And if I know you're sleeping outside, those are the patients that we typically focus those to versus ones that are going to go into a shelter. The other ones still need to be warm. They're not in the shelter all day, so they're still out walking around, and it's very, very cold. And we've taken care of multiple patients that have been weather exposed, heat or cold. It's nothing you want to be out in unprepared.
Thank you. And what, anybody have any questions that they'd like to ask Councilmember Prepty? You're recognized.
Thank you, Madam Chair. And so is there any particular need for, I guess, delicates, so like socks, undergarments, and things like that? Because I know oftentimes for our unhoused population, those are clothing items that are oftentimes overlooked. So could you talk to the need for those particular clothing items?
Sure. Underwear is actually on our critical need right now because we don't have very many of that. And the sizing is so variable, it's hard for them just to get us a bulk amount. So underwear for men and women is needed right now, as well as we will need warm socks. We have a lot of regular socks right now, but when we shift to driving for winter, those thick, warm socks they're going to need.
Thank you.
Thank you.
Thanks, Councilmember Prepty. Councilmember Nash.
Thank you, Chairman, and thank you, ladies, for being here and letting us know about what you're doing. I would love if you could provide us with like a one-page JPEG of what you're doing and what you need, little sizes, bullet points, and I will put that out on my social media, and I'm sure other council people would too, to try and grow that network.
Absolutely. We do send out flyers. I do send them to the council, their foundation does. Kate, do you have any with you today? Okay, Kate in the back has some flyers that talks about what we're collecting right now for summer, and then we'll switch in the winter, and we can send those out as well. I know we sent one to Councilman Evans, so we've added that to send it out.
Yes, so I'll have the council office distribute the one that they provided.
Super, thanks.
Yeah, thank you. How about any other questions? Okay, well, I really appreciate you all taking the time to come. One thing I do want to recognize in the back, Dr. Elders, if you have anything, I know you're being caught off guard me saying, hey, would you like to say anything? But if there's anything you would like to say at the back, I'm happy to turn the microphone on back there. Okay, sounds good. We'll look forward to seeing you on Thursday during the budget conversation. Okay, very good. All right, well, thank you so much for being here. Really appreciate it. Yes, thank you all for coming. All right, we still do not have a quorum. And so I think we will go for a couple minutes to department updates until our next council member appears. And so Mr. Sharp, would you mind being the first person I call on? I'm sorry, what'd you say? Oh, no.
Thank you, Madam Chairman. You wanted to talk a little bit about Narcan, I understand.
Yeah, I think it was the kind of our carryover from the budget conversation last week. And
we bought $27,000 worth. The primary, and there's more coming, the primary delivery options are these community educational events that the behavioral health and wellness people do. If you would like to, I can send you their calendar so you'll know where one is coming to your area if you'd like. We own and operate one of the vending machines. I know they've got some downtown that the Downtown Partnership and maybe the Benton McDonough's group are doing. We've got one that's operating now. They put 700, they're loaded 3 times a week. It holds 250 boxes, which are 2 units per box. So that's 1,500 doses a week they're going out of there. And they give away hundreds of the boxes at these community events.
Yeah.
That's their main delivery option.
Thank you for kind of sharing that update. And yeah, I think getting where they're headed, or if there's a public calendar, I don't know if they keep a public calendar about those events, but anything that can be shared kind of related to kind of where they'll be popping up.
Yes, ma'am. I know the PIO puts it on the website, but I know everybody doesn't stare at those 24/7. So I'd be happy to get their calendar on probably maybe a weekly or maybe a monthly basis. I'm not sure how far out they schedule these things.
Okay.
And send it to you guys if it'd be of interest to you.
That sounds great. I appreciate that. Thank you so much. And thanks for being the first person. And since we have our magic seventh member who is here, I'm going to hop over really quick and we're going to do the legislation before we start losing people here at 4:30, if you all don't mind, because we officially have a quorum with Chair Porterfield. So I have a proposed consent agenda of everything, every item on a proposed consent agenda. Is there anybody who needs to pull any item off? Oh, you're kidding? Okay. You know how I like a kidder, Chair Porterfield. Anybody else have anything that they'd really like to pull off? Okay, all right. We're going to go ahead then, and we'll start with item number 1, RS 2025-1221, a resolution accepting a grant from the Tennessee Department of Mental Health and Substance Abuse Services to the Metropolitan Government acting by and through the Davidson County General Sessions Court to provide Tennessee Certified Recovery Court Program, or TCRCP, services to include intensive court supervision, mandatory drug testing, and substance abuse treatment as an alternative to adjudication or incarceration. Item number 2, RS 2025-1222, a resolution accepting a grant from the Tennessee Department of Mental Health and Substance Abuse Services to the Metropolitan Government, acting by and through the Davidson County General Sessions Court to provide Tennessee Mental Health Court Program services to support adult mental health court programs and treatment services to nonviolent offenders. Item number 3, RS 2025-1224, a resolution approving a grant from the Tennessee Housing Development Agency to the Metropolitan Government, acting by and through the Metropolitan Action Commission to be used for the Emergency Rental Assistance Eviction Prevention Program in accordance with the purposes set forth in Section 3201 of the American Rescue Plan Act of 2021 to provide financial assistance and housing stability services to eligible tenants. Sponsors Porterfield, Evans, and others. Item number 4, RS 2025-1230, a resolution accepting a grant from the Tennessee Department of Health to the Metropolitan Government, acting by and through the Metropolitan Board of Health to provide the Tennessee Breast and Cervical Screening Program to offer individualized assistance to clients and to facilitate timely access to quality screening and diagnostics. Sponsors Porterfield, Evans, and others. Item number 5, RS 2025-1231, a resolution accepting a grant from the Tennessee Department of Health to the Metropolitan Government, acting by and through the Metropolitan Board of Health to provide the Community Health Access and Navigation in Tennessee, or CHANT, program to deliver comprehensive care coordination services to eligible families and children. Sponsors Porterfield, Evans, Welsh, and others. Item number 6, RS 2025-1241, a resolution approving Amendment 2 to a grant from the Tennessee Department of Children's Services to the Metropolitan Government, acting by and through the Office of Family Safety to support the provision of services to families who have experienced domestic violence and child abuse neglect. Sponsors Porterfield, Evans, Welsh, and others. Item number 7, RS 2025-1242, a resolution approving an amendment to a contract between the Metropolitan Government of Nashville and Davidson County, acting by and through the Metropolitan Nashville Police Department and the Mental Health Cooperative Clinical Personnel. Sponsors Porterfield, Evans, and others. And then bills on second reading, we have item number 8, BL 2025-821, an ordinance to provide for the designation of public property within specified areas of downtown Nashville as a temporary special event zone during the time period beginning at 9 p.m. on July 2nd, 2025 and ending at 11:59 p.m. on July 5th, 2025, relative to the use of these areas in conjunction with the 2025 July 4th celebration and related activities and events. Sponsor Coupon. Do we have any items that need to come off consent? Oh, there is? Oops, sorry. I was using something I downloaded from the internet, and surprisingly, it is wrong. Okay, item number 9. BL 2025-823, an ordinance approving a solar services agreement between the Metropolitan Government of Nashville and Davidson County, acting by and through the Department of General Services and Cherry Street Asset Management Holdings, LLC, for the design, construction, operation, management, and administration services related to photovoltaic solar facilities located at the Southeast Police Precinct. Sponsors Porterfield, Evans, and others. All right, anybody have anything that they'd like to remove from consent? Do we have a motion? All right, we got to move. A motion has been properly seconded. All those in favor? Anyone opposed? Anyone not voting? All right, so we recommend approval on all these items, 7 in favor, 0 against, 0 not voting. Okay. Thank you. So we'll go ahead and we will pick up Office of Homeless Services if you have a department update to share.
Hi, folks. Oh,
Hi.
hi. I'm Allison Cantway with the Office of Homeless Services. April is passing around our award package, which I know y'all are very familiar with at this point. Of course, there are tons of data in here on all sorts of things, but I did want to direct y'all to the highlights from the month of May, because of course we've got a lot of things going on, particularly with our unhoused neighbors. So one thing, which is, sort of appropriate right now, is that we're monitoring the storms that have been coming through. Our emergency services manager is working really closely with Chief Swan and OEM to make sure that we're able to provide services to those folks so that they're safe from the storms. So that includes things like providing bus passes so that folks can take the bus indoors to a safe space, to a shelter, a provider, or a library. Dispatching rides if folks are outside and, the weather's becoming unsafe, having somebody come pick them up and take them to a safe place. And then we have safety checks going on at encampments, just to provide resources, make sure folks know that weather is coming, to help try to keep them safe. I will also say that, as we know, federal funding, there are changes that are happening literally every day. So in every area. So we're following that extremely closely. We're communicating a lot with the agencies that receive the Continuum of Care federal funding and with all local agencies, right? So that they, have the information that we have as the collaborative applicant and the COC lead. We want to make sure that we're really playing that part. We're in really regular communication with all the agencies that receive COC funding. We've been meeting with them. We've been sharing information with them about what we know, and collaborating with each other on contingency plans just in case the funding shifts, so that services will continue. And again, I know that this is happening in every social services sector right now, but we've seen a lot of really good collaboration, which I think is very hopeful. The Hospitality Hub of Memphis is here, working with the interim housing guests at 95 Wallace. They are working really closely with our outreach staff down there at the Anthony's Drive encampment, and so moving people into that housing. People and pets, I might share. I don't have the most updated pet number, but it's 10, 12, something like that. Don't quote me on that, but it's something around there. And then lastly, so Shelby House, which is a development that received funding from the Affordable Housing Gap financing. They received allocations of $2.1 million and $712,000 and change. They're in discussions with MDHA to restore those funds. And of course, our landlord engagement team is working with them, really constantly, daily, to make sure that the property staff and also the clients are having, all of their needs met. So those are our updates. I'm happy to go into anything, any more in depth if you'd like.
Yeah, would you mind, talking a little bit more about the Shelby House, in particular, like what's the challenge that they have had and kind of why do they want to send the money back?
Yeah, I think it's no surprise to any of us that, our unhoused population, they have a lot of needs. And we have really focused on making sure that we are serving the chronically homeless, the folks who have been outside for the longest amount of time, who often have the most service needs. They have the highest barriers. And that's not easy work to do, right? So a lot of the people that we have out on the street, they've experienced years and years and years of tragedy and trauma. They may be experiencing mental health issues. They may be experiencing severe physical health issues, substance abuse. The list goes on of what all those barriers are. And we're really committed to a housing first model of, it doesn't matter what your barriers are. We want you in housing. right? You can't ask someone to improve their physical health and get clean and get all the mental health treatment that they need and all those sorts of things if they don't have a solid, stable place to go. Housing First is a nationwide best practice, but that means that when folks go in, right, they often have all of those challenges that pop up. We have service providers that are really specialized in that area and know how to provide these sorts of services. And they've been working with the folks at Shelby House, but I think it's just a little bit of maybe a different model. But again, we're really committed to it's not easy, but we want to serve the folks that need the services the most.
And so with the with Shelby House needing to basically kind of figuring out that this is not really a setup that kind of works for them. Mm-hmm. And so they're returning the money. It goes back to MDHA. Mm-hmm. Based on what we had previously passed, does that mean it goes kind of into the Barnes Fund with kind of the focus on low barrier housing, or help me remember kind of some of those discussions that we had before?
Oh, Mary Jo is working on that.
Oh, okay.
Of course, we will update y'all as soon as we know solid things, but we wanted to give you guys a heads up on that.
Okay, so I guess my question for Mary Jo, or maybe y'all could, is really like, is there the potential then for it to be reallocated to another provider who is creating the units that we need, you know, to be able to serve kind of this population? I guess that's kind of where my head is, and yours probably is as well.
We would be happy to follow up on that.
Okay. And then can you give everybody the update on the kind of the pallet shelter interest meeting that you had?
Absolutely. I'm glad. Thank you for bringing that up. So we had a public meeting last week about the pallet shelters. Obviously, there's been a lot of community interest, especially in utilizing those for our unhoused neighbors. And so we scheduled a community interest meeting. We sent it out to our Continuum of Care listserv, which has a reach of about 1,000 people. So it got sent out there a lot. We had a pretty good crowd at the meeting. It was virtual. We had folks from multiple Metro departments. So from fire and NDOT and the mayor's office and the health department and our office, and Madam Chair was there as well. Mm-hmm. We had a lot, we asked a lot of questions of, do you see your organization being involved in this? What do you think the barriers might be for you to become involved or for other agencies to become involved before we release this RFP? Because we want to make sure that we put this out there in a way that's very accessible for service providers. So we had a lot of interest. A few people have followed up afterwards to say, hey, my agency might be interested, or I know other agencies that might be interested, or I know a church. So that's really exciting. The RFP is going to be released this week. And so, of course, we'll keep y'all updated on that. But I feel very hopeful. I feel very encouraged after the meeting last week. I think there were really great questions and obviously a lot of really passionate people.
Yeah, thank you for kind of taking oversight of that after we lost the positions in the health department. I've said that multiple times, but thank you again for adding that to your plate. Anybody have any questions for Office of Homeless Services while they're here? I guess I'm kind of thinking ahead, so I'm going to talk out loud. So we will not have any presentations at our June meeting. Actually, June 3rd is going to be kind of our follow-up related to the immigration special called meeting. The middle of the month, whatever date that is, June 15th, I think, we won't have a presentation, or 17th, because we'll be right in the middle of the budget conversation. But July 15th, and I think I've mentioned this before, that I was trying to schedule Adam Rosenberg to come and talk about like a developer who's navigating kind of the support services side. And so I guess I would say that if there's anybody that has questions that's specific to any of the material, that April provided, if you're able to send those in to Margaret, and then maybe we can share those with you in advance of like that first meeting of July, just so that way I think it might tee up like, here's all this discussion kind of related to these data points, and then you'll hear from somebody that's actually in the trenches kind of building housing and converting hotels and those kinds of things, and some of the opportunities he feels like he has as somebody who's kind of dug into the support side. So it might be kind of a good, we hear from you and then hear from them, which would be a reverse of how we normally hear from y'all. So just to put that on your radar where my mind is. So I really appreciate the information. Thank you very much.
Yeah, thank you.
I see, it looks like, is it District Chief? I'm sorry, Mr. Young, I can't remember your new title. I don't know if you have anything to add from fire.
Yes, ma'am. Thank you, Chair. I've had a few council members email me, Councilman Prepteet, most recently. He was asking questions about the declaration on the flood about, what now, we're on two months ago, maybe. So what we do know is Davidson County submitted their findings and their estimated loss. Other counties that were involved has done that. Governor Lee has sent the full declaration to D.C., and it's actually in the hands of the federal office for release of any funds. That's all we know at this point, because we have had some constituents out asking, that were affected. When is some of this relief coming? We'll keep you posted when we know more, but that's kind of where it's at.
Okay, thank you very much for that update. And then Pastor Tucker, you don't normally kind of pop in when we're having department updates. Do you have anything from MHRC that you want to share with the committee? I'm putting you on the spot. You don't have to speak, but I can't imagine you won't take this opportunity to speak.
Two quick things, Madam Chair. First, I just want to applaud you for, I think, the foresight to hold a special call meeting, and I thank you for that. The other is MHRC has begun an initiative called Humans Over Hate, and what we're doing now is an initiative called No Hate on My Plate, where we're holding communal meals with desperate groups of people just around having conversations to create places for reflection and shared understanding. So we've had we've had 4 already. We've got another 4 planned, and we're looking for sponsors also. And we would love if a councilman would like to host one in their district, that we'd love to help them put it together. Because I don't think we can debate our way out of where we are now. Fighting hasn't worked. So maybe if we could just reason, we could find a place to coexist with our own shared values as they intersect, interconnected, overlap with each other. So thank you very much.
So they should, anybody interested should reach out to you about sponsorship and what that entails and that kind of thing.
Yes, ma'am. Reach out to me or anyone attached to our staff, and we would love to do that.
I really am intrigued by this idea, mainly because I can almost immediately determine what people that I've heard from about different issues that would be ideal to invite to come together on things like this. So I'll definitely follow up and check in with your team.
Thank you. So thank you. Also, thank you for the recognition.
Of course. It all depends on who I can see, and back past the podium, it gets a little dicey. So I don't know if can't see that there's any other department heads back there. Are there? Am I missing anyone? Okay. All right. Well, I guess the last thing I'll mention, June 3rd is our follow-up meeting, and Director Darby has submitted, kind of aggregated all the questions from the special called meeting. They've been submitted to the administration, and so there'll be some feedback kind of coming our way in advance of that, but we'll use that as a follow-up time as opposed to having a speaker at that meeting. And so if there's nothing else from the group, I will call this meeting adjourned. Thank you.